Hello, everybody. Welcome to our webinar today. We're going to be beginning here in a few minutes. My name is Helen Hockey. I am the Executive Director for the Pennsylvania Coalition for Oral Health. We're very happy that you decided to join us for our lunchtime webinar. Just as a reminder, all lines have been muted. You are joined as an attendee for the webinar. The webinar will be recorded, so if there's something that you miss or you want to go back, we're going to be having that recording shared out afterwards. For any technical issues that you have, we would ask that you place those requests in the chat box, which is in the bottom black bar across your screen. If you have questions for the panelists as they are presenting, we invite you to put those in the Q&A box. So as a reminder, questions go in the Q&A box, technical issues go in the chat. Some of those questions may be able to be answered via written content as we go through the slides. Others we will make sure that we address at the end. So with that, we'll go ahead and get started. We're really pleased that we had the opportunity earlier this year to start this project and to be able to work with the very world-renowned American Dental Association's Health Policy Institute on a dental workforce report for Pennsylvania. We've all seen a lot of the numbers that come through, and so many things kind of tend to come from that national perspective. So we really we're happy to have someone who could dive into the piece around what Pennsylvania looks like specifically, where we're heading, and sort of then maybe hopefully make some policy intervention and changes to improve oral health outcomes for our residents here in Pennsylvania. So again, just as a reminder, we will record the meeting, and so hopefully you guys can kind of join in and answer some of those, get some of your questions answered, and we hope that in the future you'll be able to work with our coalition on improving some of these outcomes too. So with that, I'm going to go ahead and turn it over to Dr. Marko Vucisic, who's going to start us off.
Thanks, Helen, and a pleasure to be here. As Helen mentioned, this has been a great partnership to work with the coalition on this. In case you don't know much about the Health Policy Institute, just a quick intro. We are a think tank specifically focused on research and data in the dental care sector. We do scholarly work, we do briefings for policymakers, we do reports, we do data updates, and increasingly our work is not only cited in the media and people talking about oral health issues, but some of the things we're most proud of is working directly with either legislative bodies at the state level, oral health coalitions like yours, to really kind of put evidence in front of decision makers. And so that's a little bit about us. Today, I'm joined by Becca and Brad, who did a lot of the heavy lifting on this report. You'll see us live at the Q&A session at the end of this. As Helen mentioned, keep the Q&A, use the Q&A box for questions for the team here. And just to tell you, where this came from, Helen was very brief, but this is funded by a few groups, the coalition itself, as well as the Department of Health, and this other organization, the Health Education Center. So that's the kind of the genesis of this project. And what we're doing is, today, the COVID bit is a little bit outside of the narrow scope, the specific scope of this project, but we included some of the most recent data on where the COVID recovery is going, where the COVID recovery is in the dental sector in Pennsylvania. So you're going to see some specific data for Pennsylvania related to patient volume and things like that. But the real meat of the report is the next 4 bullet items. We were asked to do a forward-looking projection model of the Pennsylvania dentist workforce. You'll see results there. We specifically were asked to look at sources of inflows and outflows of dentists. in different areas of Pennsylvania, which is really nitty gritty, but you'll see that. Both of those have some pretty strong implications about future workforce adequacy, which we'll tell you about. And the fourth bullet, the survey of Medicaid enrollees, is really novel. We were able to survey a representative sample of households covered by Medicaid, who were insured by Medicaid, and we're able to ask them a series of questions about their dental care use and how easy it is to pay for dental care, find a dentist, etc. And then we're going to summarize it all with some very high level key takeaways, including policy options that ought to be discussed and potentially pursued based on the research out of this report. With that, I'm going to hand it over to Becca to walk us through the first part here on what we've learned so far about the recovery from the COVID pandemic.
Thanks, Marco. So like Marco said, we're just going to mention some highlights from our COVID findings in Pennsylvania. Just some background, we started this tracking poll back in March 2020, and since then we have surveyed thousands of dentists in private practice. Some of the key indicators that we have included have been the status of the practice. So our practice is open for emergency only, or closed. We've looked at patient volume and collections compared to levels before the pandemic hit, ability to pay staff, supply of various PPE items like masks, face shields, gowns, gloves, and disinfecting supplies. So this current slide shows results from 73 Pennsylvania dentists who responded in June. And on the left side, you'll see the green bar, 99% reported that they are open. And the yellow bar is patient volume. 87% of these dentists had reported that they are up to, that their patient volume is back up to 87% of the pre-COVID level. And you'll see that compared to the right side of the chart, these numbers are in line with what dentists had reported nationally.
And as Becca mentioned, there's, if you want more details on our webpage, ada.org/HPI, we have a whole COVID section, and there's a state level dashboard where you can look at Pennsylvania compared to, for example, other states. But as Becca mentioned, the recovery is very robust. We did not see any sort of spike in retirements or things like that. In addition, some of the patient reported sentiment is really positive. Now, we don't have that data state by state, but nationally, for example, 97% of patients are very comfortable coming back to the dentist or have already been. That's the highest it's been since we've been tracking. So the recovery is progressing very well, very robust. And one thing to mention is the biggest challenges now practices are reporting are with hiring hygienists, hiring dental assistants. Significant share of practices with vacancies are reporting it's very, very challenging to fill those positions. Anyway, there's more in the report. There's more online. We just wanted to give a quick snapshot. Thank you, Becca. With that, let me turn it over to Brad now, who will talk about our dentist workforce projections for Pennsylvania.
Thank you, Marco. This is a slide representing our approach for the dentist workforce model, which allows us to project the number of dentists in Pennsylvania in the future. We do this by looking at the historical trends for dentists entering and leaving the state. On the left side of this diagram, you see the inflows, those groups of dentists who enter the state's dentist workforce. And on that left side of the diagram, the top two boxes are the most influential. That is, major sources of inflows being US graduates from dental schools and established dentists who move into the state after having started practicing in some other state. The outflows on the right side of the diagram represent those dentists who are leaving the state's dentist workforce, and the retired group is the most influential kind of outflow that we observe, along with the other kinds of outflows, like dentists moving out of the state but remaining active, or dentists who have their license lapse or who decease. Next slide, please. This graph represents the idea that the number of dentists entering and leaving the state in the near future will be almost balanced. The orange bars on this graph represent the number of dentists who left the workforce over a period. The yellow bars represent the number of dentists who entered the workforce over a period. And the short green striped bars represent the difference between those dentists leaving or coming into the state. Along the horizontal axis of this graph, along the bottom, you can see that there are 5-year intervals represented. And on the left part of the graph are historical trends in dentists entering and leaving the state. You can see that for the interval of 2015 to 2020, there were an average of 408 dentists leaving the dentist workforce every year, an average of 344 entering the state's dentist workforce every year. And that netted out to a net loss of about 64 dentists leaving the dentist workforce per year from 2015 to 2020. So that was a major decrease. But when we look at the historical trends and the composition of the dentist workforce today, projecting forward, we project that the number of dentists entering the workforce will slightly exceed the number leaving in the coming years. Next slide, please. This graph represents the finding that the supply of dentists in Pennsylvania is projected to decrease on a per capita basis through 2030 and then stabilize through the year 2040. This graph is where we compare the number of dentists to the population, because both groups are growing. It's just that the population in Pennsylvania is projected to grow faster than the number of dentists in the state. Again, this is a graph that has historical numbers on the left half and projected numbers on the right. And the historical numbers from 2015 to 2020, you can see that the number of dentists per capita had a major decrease. And we project that based on historical trends, it will continue to decrease a little bit more through the year 2030. And after that, the supply of dentists should stabilize and start to increase. I want to mention that the green line on this graph is the number of dentists compared to 100,000 population in the state. And the national measure right now is around 61. So currently Pennsylvania is just a little bit lower than the national measure for dentists per 100,000 population. On this graph, the yellow and orange lines represent full-time equivalent counts of dentists, because we're recognizing the fact that dentists report to us in surveys that their number of hours worked per year and the number of patients that they see in a week will vary depending on the gender of the dentist and depending on the age of the dentist. So that's why we have added full-time equivalents to this graph to show that while those numbers are a little bit lower than the head count, their trends parallel the green line on this graph.
And Brad, it's Marco here. Between 2005 and 2015, right, we see the green line's flat, meaning that the number of dentists per population is flat, but both of those FTE measures are declining, like those first 3 data points as you go left to right.
Right.
Am I right to assume that's because the dentist workforce is aging during this period and older dentists on average work fewer hours?
That is true, that from 2005 to 2015, that this is both nationally and also for Pennsylvania, the dentist workforce was getting a little bit older every year. But after 2015, both in Pennsylvania and at the national level, the dentist workforce is starting to get a little bit younger on average. And that's because, partly because of the 10 new dental schools that opened just prior to 2015. I think it was from 2008 to 2016. There were 10 new dental schools that opened in the US. And when you have that many new enrollees or graduating, it brought the average age of dentists down a little bit,
Okay.
combined with the retiring dentists who started to retire after 2015. There was a big bulge of dentists who started to retire after 2015 in Pennsylvania. That's right. Next slide, please. Oh, the purpose of this table is just to show the historical and projected female share of the dentist workforce in Pennsylvania. You see the years across the top. The left half of the table is historical, and the right half is projected based on historical trends. Along the bottom line, we see in bold the percentage of the dentist workforce that is female. Starting in 2005, this was 16%. In 2020, that share had doubled to 32%. And at the rate trends are going, we project that the female share of the dentist workforce will be up to 52% by the year 2040. The other thing to notice about this table is just by looking at the various rows, which represent different age groups of the dentist workforce, and that for the year 2020, for example, for dentists who are younger than 35, 53% of them are female. And for the other age groups, you can see that how the percentages vary as far as the female share of the dentist workforce. Next slide, please.
And this now will go into the inflows and outflows analysis. So go ahead, Brad.
Right. And for this section, the highlights that we're showing here have to do with the locations of dentists within the state, where we group Pennsylvania's counties into different categories. On this slide, we have a couple of red arrows pointing out the highlights of the table. The first red arrow is highlighting the line pertaining to all rural counties of Pennsylvania grouped together. And among rural counties, the measure of dentists per 100,000 population is only 31. But for urban counties, the next row down, the measure is 61. So the supply of dentists in rural counties, proportional to the population, is much less in rural counties than it is in urban counties. And there's a similar contrast when we can look at dental HPSAs, or dental health professional shortage areas. In the second red arrow on this table, pointing to the line for dental HPSA counties, the measure of dentists per 100,000 population is 41, compared to 62 for dentists in non-dental HPSA counties. Next slide, please. Again, these two red arrows are pointing to the same kinds of counties as on the previous slide, but the point of this table is to show the distribution of dentists' ages first within rural counties here. The first red arrow shows it for the line devoted to dentists in rural counties. The age distribution shows that for those green cells we've highlighted, those green cells in the table represent dentists who are aged 55 or older. And in rural counties, about 52% of those dentists are age 55 or older. That is, they're nearing retirement. And similarly, on the second red arrow for this table, pointing to the line representing dental HPSA counties. Again, those two green cells add up to about 51%, 51 or 52%. So again, the majority of dentists in these dental health professional shortage area counties are age 55 or older, again, nearing retirement. And I want to mention before we leave this slide that in the full report, we provide these kinds of numbers for every single county in the state. So you can see how the age distribution of the dentist workforce varies for every specific county in Pennsylvania.
So Brad, right, punchline here, this is, you showed us here that the supply of dentists in rural and HIPSA counties is much lower than in
Right.
other areas of the state.
Right.
And you're showing us here that it's about to get lower with a wave of retirement, roughly. Am I right?
Right.
Okay.
Given that we don't know what's going to happen with inflows into these counties, but we have a good sized cohort that are ready or nearing retirement.
Gotcha. Okay. Excellent. Thank you, Brad. Let's go now, switch gears totally. That was all about the dentist workforce. The next set of data you're going to see is from the population of Medicaid enrollees in Pennsylvania, and Becca will walk us through that.
So first, I'm just going to go over some background information about the survey. We conducted it online. It was distributed via email to a panel of adults in Pennsylvania, and we collected responses between April 30th and May 11th of this year. Adults were eligible for the survey only if they reported that they lived in Pennsylvania for at least 1 year, and if they had indicated Medicaid or Pennsylvania's medical assistance program as their health insurance coverage. In total, we got 635 responses from adults, and of those, 324 also answered questions about their children's dental visits. Next slide, please. So first, we asked about awareness of dental coverage under Pennsylvania's Medicaid program, and we found that the majority were aware that dental benefits are included in Pennsylvania's Medicaid program for both adults and children. Next slide. We also asked about the last time they had visited the dentist. So if you look at the green sections in the chart here, adults are on the left, children are on the right. We found that nearly 3 in 4 children had a dental visit within the last year, while less than half of adults had been to the dentist in the last year. Next slide.
And Becca, maybe highlight the orange as well, because that's a huge difference.
Yes, so about 1/3 of adults had not had a visit for more than 2 years. And this was very small among children. We also asked about the reason for the last dental visit, and most reported that their children had gone for a checkup. So this is the green bar on the right side of the chart at 88% for children. But a significant portion of adults went because something was hurting or bothering them. And this is represented in the orange bar on the left side of the chart. That was at 45%. So,
and Becca, an important
yes.
insight, if I'm right here, is that the nature of visits is very different. For children, there's a much more higher likelihood it's a routine visit, it's a checkup, it's prevention. For adults, we see it's much more geared towards acute issues in managing something that's flared up. Am I right?
Yes, that's exactly correct.
Okay.
Next slide. So we also asked those who had not been to the dentist in the last year why they had not gone more frequently or at all. And this is an excerpt of the top 5 barriers that were cited by adults. So the purple bars represent adults, the green represent children. If you look at that top bar, you can see that cost was the most frequently cited reason at 38%, but trouble finding a provider that accepts Medicaid was a substantial barrier both for adults and children. So that's the 3rd reason down. For adults, 28% cited this reason, and 20% cited the reason for their children. And also in general, you'll notice that barriers were less often cited when it came to children versus adults.
And I think that's a really important thing. This chart's very, very telling. I mean, if you just focus on the green bars, right, for kids, the top barrier is finding a provider. For adults, that's not the top barrier. It's among the top 3, but the top barrier is cost. And we'll get to this. This is very important because there is a benefit, right? There is a dental benefit, but clearly for adults, it's not covering what they perceive needs to be covered. So that's a very, very important telling finding, and that there's this difference by age group.
Okay, finally, We asked a couple of questions about the impact that problems with the mouth and teeth have had on feelings of life satisfaction, as well as the ability to interview for a job. So on the left portion of the slide, you'll see a chart showing that nearly half of adults said the condition of their mouth and teeth had affected their life satisfaction at least occasionally. So if you look at the orange section of that chart, 29% indicated occasionally, and in the purple section of the chart, 20% said very often. And then on the right-hand side, if you look at the chart there, you'll see that 2 in 5 adults said that it had affected their ability to interview for a job. And these findings support the notion that oral health really does impact other aspects of life for this Medicaid population.
Okay, thank you, Becca. Really telling. And again, you see where we're going, right? You have, Becca showed us high awareness of the benefits. So it's not like people don't know that there's coverage, but very different nature of visits here and here. And I think, as I mentioned here, as Becca showed us, really telling that cost for adults is a significant barrier, even though there is a dental plan for adults in Medicaid. And I think this just goes to show that this is not trivial, right? These issues of cost and other barriers for adults have pretty significant impact, including economic impact in terms of livelihood and finding a job, etc. on the right. So those are the segments of the report, the main chunks with the research. We now just want to zoom out again, very high level. What does all this mean from HPI's perspective? And how does this suggest policy options? So I will just leave this on the screen and maybe read some of it. But there are 4 big conclusions we feel that are merit highlighting. The first is just generally the supply of dentists through 2030 will decrease from now till then, and then will stabilize. And as Brad said, that's a result of outflows slightly exceeding inflows, or sorry, vice versa, inflows slightly exceeding outflows. But frankly, that's not anywhere close to keeping up with population growth. The second one is this issue of rural and health professional shortage areas that we were asked to look at specifically. We definitely are forecasting a wave of retirements given the age profile of the workforce in these types of areas. Less so in relatively in urban areas. But I think remains to be seen, is there something to be done in Pennsylvania to attract younger dentists to these shortage/rural areas? And the third conclusion I want to reiterate again is the awareness among Medicaid beneficiaries about the benefits is very high. That's not really an issue, but the bottom line really is there, the fourth bullet. For whatever reason, and again, we haven't gone into the details of the benefit design and things like that, but financial issues, affordability among Medicaid adults is the top reason. And again, we want to mention in second place for adults, actually in third place for adults, but first place for children as a barrier is this issue of finding Medicaid accepting dentists. So those are kind of the big conclusions, and they lead into what we think are some policy areas that, you know, the coalition with others should continue working on and potentially advocate for. You know, how do we fix these issues? So one is this broad policy area of really considering targeted interventions to attract and retain dentists in some of these underserved areas we've highlighted, particularly younger early career dentists. And again, we offer some insights on that. Things like loan forgiveness, scholarships, other financial incentives, potentially the pipeline, recruiting students from rural areas. In terms of the shortage areas, potentially trying to increase diversity in the Pennsylvania dental school population. Again, the report did not go into that, but we do want to highlight it as a potential further area to look into. And again, for something like student loan forgiveness or financial incentives, you know, it's easy to say that, but how big do they need to be, and how many of these do you need? You know, we've told Helen we have analytic work that can help get to that. Is it $10,000 a year in loan forgiveness, or is it $60,000 that's needed to get a significant change in behavior? Again, that's potentially some subsequent research. But again, the nice thing about this paper and this research is, as Brad mentioned, we have a list of counties. We've looked at these data county by county, so you could potentially use our analysis to say, okay, let's target these 3 or 4 counties only for some of these interventions, right? It's a nice tool for policymakers. The second big area is to re-examine and look more deeply into the adult benefit, dental benefit design in the Medicaid program. We've said pretty plainly, it doesn't seem to be working. If you have coverage, you should not be reporting major financial barriers, nor should cost be the top reason you're not going to the dentist. And so, you know, this is clearly a situation where the majority of covered adults are not really in the preventive routine care pipeline. It's symptomatic issues. Maybe that's why the cost is a key barrier. I don't know how much of the major restorative work is covered by the program. Maybe that's the core issue. But something is not working there. And again, this issue of Medicaid providers is, it's not just your state that's dealing with this, but you know, we haven't, there's certainly some deeper dive to be done there, right? So you could think of somebody saying, I don't go to the dentist because it's hard to find a provider. That could be because there are no providers. It could also be that there isn't an easy search tool. It could be that providers have long wait times, but they're around me. You know, again, that's a little bit beyond what we were able to do in this version, but certainly follow-up work could go deeper into this issue, because that's not a simple, straightforward issue of, oh, let's just get more dentists into Medicaid as providers. May not be the issue. I don't know how easy from a beneficiary side it is to find an appointment next Tuesday after 4 o'clock. If I'm a Medicaid adult and I want to do that, is there an easy tool? Does the state offer this type of lookup program? Can I book appointments online? I would doubt that, but I don't know. But that's the kind of follow-up potentially research that can be done. So with that, I'm going to stop screen share. I'm going to bring us all back here so you can see us, and let's bring Helen back and everybody else. And Adriana as well, as I understand, you've been monitoring Q&A. And Helen, let me first give it back to you for any kind of summary remarks or anything you want to add before we dive into the Q&A.
Thank you. And I think we said it a couple times, but I just want to make sure everyone's aware that we will be sharing the full report. We wanted to wait and sort of have the kickoff launch today. But for someone like me that really loves to look at those data and like dig into them, it's an amazing report, and we can't thank you guys enough for doing such a good job with it. You know, I know that we have some questions to answer, but I do want to point out that one of the main outcomes, you know, we wanted to do this deeper dive. We wanted to see some of the bigger picture for our state level information. But what we're really hoping is that our coalition can start to really address some of these issues. And, you know, be more proactive instead of reactive, because I think to this point right now, we've gathered a ton of information, you know, and it's not just dentists, it's all the dental staff, and it's the the dental health professional shortage areas, and it's the licensure data, and it's who's seeing patients with disabilities and who's seeing patients with Medicaid. And there's so much. And so it's really time. It's just timely for us to gather a task force and to start working on some of these things. And we're really, I mean, we're excited about it. It's sort of a little daunting, but I think that one of the outcomes I just want to say to everyone who's joined us today is that, you know, this report's definitely not the end. Like for us, it's sort of the kickoff to how we can start addressing some of these issues. And so stay tuned for that piece. And, you know, I hope everyone at least can find their place with that. We do, because our state oral health program and our state oral health plan do address dental workforce as an, you know, a top priority. I think that, you know, we've got a lot of buy-in from a lot of different partners on this. So we're not going anywhere on this subject. This is not a one and done thing. So I would just say that I know there's a lot of questions coming in and comments and just that, you know, there's a lot of work to be done. So be patient with us and we will definitely start to make some progress.
Okay, so hi everybody. I'm Adriana Menezes in the Health Policy Institute team. I've addressed some of the questions that as they came in. So if you have any additional questions or if you need any clarification, please send them to the Q&A box. A few questions just came in, so I'll just read them and I'll have Marco decide who should be commenting on that. C. Campbell said, how can we incentivize adults who have Medicaid to get them to use their 2 preventive visits per year?
It's a great question. I don't know, Helen, you know, we don't have the specifics in Pennsylvania. But again, I think part of this potentially could come through better collaboration with primary care, touch points, physicians, clinics, in terms of referring or funneling people. Certainly, can you engage? I don't know how engaged the Medicaid program itself is in terms of outreach for core prevention and wellness services. I don't know if there's quote unquote outreach / marketing for dentistry in those areas. But those are a couple things. You know, a good thing is you have a lot of the Medicaid children going to the dentist, and we do know that that has a spillover effect on their parents. But we likely have already seen that spillover effect, and clearly it's not moving the needle hugely, right? But I don't know, Helen, if and I don't know if the team wants to jump in, but I don't know, Helen, are there some initiatives already in play on this, for example, trying to get more towards prevention?
So there's 2 points here. One is that our State Department of Human Services did just initiate a pay for performance measure last year that's for adults focused on that. So we would hope to see that our managed care organizations are doing some incentivizing and we would hope to see that number change. The other piece I would say is that, you know, we often hear that because we do have more limited benefits under Medicaid, that sometimes it seems fruitless to go for preventive visits anecdotally if your services that you need, maybe in regards to periodontal services, can't be covered. So, you know, if we look at numbers of how many people typically have periodontal disease, we would expect that a lot of these people who maybe aren't getting their preventive services every year don't need just preventive services. They might need something more. The other piece, the last thing I would just say is that when we look at our behavior risk factor surveillance system data, we know that adults in general in Pennsylvania, we only have about 69% of them going for an annual visit. So 50% of Medicaid, adults on Medicaid is not that far off of where we're looking at when we look at the entire population. So that could also play a role in that we need to do a better job on all populations.
I really like that point you raised, Helen, about, you know, if my needs are X, and that's well beyond prevention, and I show up for prevention and prevention's covered, I mean, that doesn't really meet my needs, right? So it could be this issue of the program is too skinny in terms of what it's covering for these major issues. and that's keeping people away. So I really like that you raised that. Yeah.
Okay. Carrie had a question if the data was available, was stratified by race and ethnicity. So I can answer that. The dentist survey data, we do not break that out by race and ethnicity of the dentist. The public survey of Medicaid enrollees, we did collect data on race and ethnicity. We analyzed those results, but we didn't find anything statistically significant. If we did highlight those points in the full report that Helen would share with the audience. And also in the report, we do include a complete breakout by race, by gender, and others of the survey of the population. So you can dig in and see the detailed information in that report as well. So another question from Bernie was, one moment, is this meaning fear of dentists because of of COVID? Meaning, was it a different barrier of care last year because of COVID, fear of dentists, or not?
We don't know technically, but with COVID, the fear issue hasn't really materialized, right? So again, nationally, I'm talking national data, there isn't a fear of going to the dentist. People feel just as comfortable as they did pre-pandemic. So my hunch is that no, COVID did not play a role in changing people's, fear of going to the dentist. Because now with all the other things you're scared of, there's infection of COVID. I don't think that's the case based on the national data.
C. Kimball asks, why are the 25% of children not getting preventive and ill visits when they are paid for?
Helen, you did a great job with the adults. Let's see the kids
Well,
answer.
and honestly, I'm sitting here thinking, it's almost the exact same parallel. And Dr. Kimball, of course, as a pediatrician, is very aware of this. Is that, even when we look at NCHS data, which we know, National Children's Health Survey, not accurate. It's a telephone survey. You're not getting, if you call a parent and say, did you take your kid to the dentist? Of course, they're going to say, yeah, sure, I did. But even with those numbers, it's, they show that 80% of kids get to the dentist in the last year. Now, so, the fact that I think that we look at Medicaid and we see that 75% of the kids enrolled in Medicaid are getting to the dentist, I would say we have a much higher number of kids enrolled in Medicaid getting to the dentist than the general population overall of children, knowing that NCHS data of 80% is probably overinflated. So I think we're doing better for our Medicaid, and we see that number, changing so much. We see those numbers growing every year because of a lot of programs. The managed care organizations have done so many pay-for-performance incentivizing there. And so, and then we've also seen a much higher number of kids, getting those referrals at their medical office visits and getting to the dentist from there. But again, if I had to say, what is maybe holding back some of these kids from getting to the dentist, I think, honestly, we look at the multi-generational approach, and we look at the idea that if their parent doesn't have a regular dental home, these kids are so much less likely to have one as well. And so that's really, we always advocate for more adult benefits, knowing that it will trickle down to the kids and that the families will establish the dental home and get in there more frequently. But yeah, there's not a great answer for that, or is it providers? And that's something that, we know that we have many counties in our state without pediatric dentists. If the kids have a restorative need, they're not going to be going to the dentist if they can't find a provider, within a 2-hour drive of their home. So it's multifaceted.
Just to add, I don't think 100% going to the dentist is feasible. I mean, even with higher income children with private coverage, we don't see that, right? So I think Helen summarized that well. So it's all relative. You're doing relatively well with the children. And I like what Helen said about how do you get to the next level.
And the last question here on the currently on the queue, and that might be a question for others in the audience too, who has some expertise in that, not so much data driven based on the HPI research, but the question is how to address the fears that people have going to the dentist.
Yeah, we're not the group of data wonks to answer that, and none of us are dentists. I don't know. I don't know. I don't know what's been successful in the past in terms of those programs. Frankly, remember though, the data are not showing fear as the top barrier. This is something, I mean, I get the question, but the top reason is not fear. It's not even in the top 3 for adults. I don't know where it was for children, Becca. I don't know if you off the top of your head know. But certainly I would not attack that as my first priority based on these data. I think the adult benefit design is seriously lacking if it is leading to major cost barriers. I think that's a major intervention area you could look at. And again, we could talk more about how would you design a benefit plan that's like fiscally sound, but lets people get the care they need, right? I think there's opportunities to work on that.
A few more questions came. In terms of reasons not to go to the dentist, what is the difference between cost and I cannot afford to go to the dentist? I believe those may have been 2 options in the survey. Do you want to explain how we did that, Becca?
Yes, that was something I didn't cover when we looked at that chart. So there were 2 options in the list of reasons we provided. Cannot afford to go to the dentist was one, or many services are not covered and I have to pay with my own money. So about a quarter of adults cited each of those barriers, and we wanted to see if it looked differently if we combine them into an option for cost as a whole. And so that's what we did. We took those 2 options and looked at how many adults cited either of them. And we came up with that 38%.
Thank you, Becca. One last question here on the queue. With PHDHP are now able to become Medicaid providers, is there any initiative from the state to get MPI numbers quicker to providers? I have applied and it has been under review since March.
I think I should probably handle that one. So the, and really the last statistics we have with that, and Tiffany, I think you're referring with the MAID, the promise ID that DHS awards out to for our direct access hygienists in the state. The last data we have from September is there were about 140 PHDHPs that had been awarded a promise ID number. Now, as of this last licensure period, there were only about 850 certified PHDHPs in the state. So at this point, I think the interest in PHDHPs becoming, DHS MA providers hasn't been as strong. And so it may just be that it's getting backburnered, but we can certainly work on that. And I would love to sort of take that up with you, Tiffany, and see what we can do in working with DHS to see where the problem is, whether it's with getting the promise ID, whether it's with getting an MPI in the first place, or whether it's with getting credentialed with the various MCOs. I think we should definitely talk, and I know you have my number, so let's talk about that offline for sure. And if anyone else has had that problem, please feel free to reach out.
No more questions in the queue, Marco.
Great. So Helen, I'll turn it back to you, but thanks for having us. And again, hopefully we continue this partnership. And thanks, Brad, Becca, and Adriana. Great job.
Yes, and I would just echo that. I think I've sort of summed up some of our work, but the only other thing I did want to say in regards to, especially like the fear question, is many of you know that we do hold regular meetings and we do a lot of gatherings, and our work is really to try to connect people on different things. And something that just came to mind when I saw that question come up is that, we're looking towards our summit this year, which is going to be, an in-person event, 2-day event in Harrisburg, November 11th and 12th. And, we're right now building the agenda out. And one of the things that has come up as an issue that we think dental providers need to learn more about is looking at things like trauma-informed care. So, most dental providers aren't familiar with that term, or they're not using that term in their everyday work. And, there's reasons, and we want to see we want to delve into some more of the different barriers and access issues in our state as part of the summit presentations. So it may be that we can kind of dig into that a little bit more at that event, and maybe help people connect around things like that. It just kind of came to mind as I saw that question come in, that it might be helpful. So definitely, if you haven't had a chance to mark your calendars for those dates, November 11th and 12th, please do. Because I know we always have a lot of people interested, and a lot of great advocates attend that conference. And hopefully we can even report out on more of this workforce progress that we have by then. We've got a lot of things to do. So again, thank you all so much for joining us today. And thank you so much to the HBI team for coming along, doing all of this hard work, and doing a great presentation for us. We will be sending out the links, slides, presentation, recording, all of that good stuff, and the actual full report, which is 100 pages plus of glorious data. And hopefully you'll all think it's as amazing as we do. And then we can engage in some follow-up after that. So thanks again.